what do a ballerina, a soccer player, a basketball player, a military recruit, and a runner have in common? According to Dr. Carl Fields, Professor of Family and Sports Medicine, in a September 10, 2010 article on UpToDate.com, all of these athletes are susceptible to stress fractures. Stress fractures are most common among runners with an incident rate as high as 15%. Understanding the causes, symptoms, treatment, and ways to prevent stress fractures will keep us from developing these painful sports medical injuries. According to physical therapist and orthopedic clinical specialist Stephen Carras, in a September 2005 Running Times magazine article, there are two primary factors or causes for stress fractures. The first is predisposition. 60% of athletes who sustain a stress fracture have had one previously, according to Stephen Carras. Are these athletes doing something wrong, or could there be other reasons? Reasons might include low bone remodeling rates, extremes of body type, and skeletal realignment issues, according to Stephen Carras. Being female and the female triad is another reason. Stephen Carras said, women sustain the majority of stress fractures in athletics. Other reasons could be increased risks caused by nutritional deficits, low estrogen levels, and lower than needed calorie intake. And they can also be caused by disordered eating, amenorrhea or absence of a menstrual cycle, and osteoporosis. The other types are readily changeable, according to Stephen Carras. This can include improper training, inappropriate footwear, exercising on irregular surfaces, leg length variation, muscle strength issues, and inflexibility imbalances that can be changed with the help of a medical professional. According to MayoClinic.com in a December 7, 2010 article, flat feet and high arched feet are also reasons. The many reasons for stress fractures will eventually lead to symptoms that will interfere with not only your athletic abilities, but your everyday activities. The symptoms related to stress fractures vary from person to person. What you're feeling may not be the same as what she is feeling. Symptoms might include localized bone tenderness that is not the result of a trauma, pain when pressing on the bone, pain that does not decrease with rest, pain that is consistently there, pain that keeps you up at night, or pain that causes you concern that might indicate a significant injury to the affected area. Visual symptoms may include redness or swelling of the area. Once you have determined that your medical condition is serious and medical attention is needed, your next step is to make an appointment with an orthopedic specialist or sports medicine doctor. Diagnosing stress fractures can be difficult, but it is not impossible, and there are a variety of treatments available. The first tool for diagnosing stress fractures are X-rays. X-rays may not show a stress fracture right away and can take up to between 2 weeks and 2 months for a stress fracture to appear, according to MayoClinic.com. Also, stress fractures will be shown healing as opposed to developing. Another type are bone scans. This involves injecting radioactive material intravenously. This material collects where bones are trying to repair themselves, according to Mayo Clinic. Bone scans are not specific for fractures, and many bone problems may look alike, according to MayoClinic.com. Another diagnosing tool are MRIs. They use radio waves and magnetic fields to show stress fractures. They also may show up within a week of symptoms occurring, according to MayoClinic.com, and they are better able to determine if the injury is a stress fracture or soft tissue issue. Another good way of diagnosing is hopping on the foot, if the affected injury is in the leg. Treatments vary depending on the severity of the injury. Medicines may be taken for pain, which can include acetaminophen or Tylenol. But according to MayoClinic.com, you'll want to stay away from anti-inflammatories, as these can interfere with the healing process. Also, doctors will recommend reduction of weight-bearing load on the bone. This can include a walking air cast, a brace, or crutches. Also, resting the injured limb is vital to the healing process. And most importantly, do not participate in the sport or athletic activity that caused the stress fracture. More often than not, no impact activities are recommended, such as swimming or stationary bike riding. And for the most severe stress fracture, or those located in areas of low blood supply, surgery may be required, according to MayoClinic.com. Also, according to Stephen Carras, if the fracture spans totally across the bone, surgery might be required. Surgery involves putting plates and screws or metal rods, inserting them into the bone to ensure complete healing. Once the healing process is complete and your doctor has given you permission, you may slowly and gradually begin weight-bearing activities again, paying special attention to ways to prevent stress fractures from occurring. All injuries, including stress fractures, can be prevented. Using proper equipment, such as proper running shoes for your specific foot, and replacing footwear as needed is very helpful. You'll also want to make changes to your routine slowly, allowing bones and muscles to adapt to the new conditions. Also, cross-training is important. Incorporate low-impact activities into your high-impact regimen. And if you're a runner, do not increase your weekly mileage by more than 10% each week, according to Christine Luff, fitness writer, avid runner, and running coach in a May 4th, 2011 About.com article. Also, according to Christine Luff, take days off to avoid putting too much stress on certain areas of your body. You'll also want to get proper nutrition to keep your bones strong, including proper calorie intake, D3 supplements, and calcium supplements. Most of all, listen to your body. According to orthopedic surgeon Dr. Jonathan Clouet, in an October 6, 2009 About.com article, he said, "If there is pain, do not do it." Even if you develop stress fractures, no matter what the reason, once diagnosed and fully healed, many people successfully return to their desired sport, paying special attention to prevention methods to ensure another injury does not occur. Stress fractures are a serious injury that, if left untreated, could progress into something more serious and more expensive to treat. I have a personal experience with this. I began running in March, and shortly after, I began getting pain. This was due to running 3 miles, progressing quickly to 4 miles, and by the end of the second week, running 5 to 5.5 miles at one time. I wasn't taking calcium, I wasn't taking D3, and I wasn't getting enough calories. This sent my body into shock, and I was torturing my body. So I took 2 months off, got a gym membership, and concentrated on this Stairmaster. Then, I began running again, making the same mistake as last time. I didn't last 2 days before the pain occurred again. Then, I took another week off and tried it again, more pain. I was unable to run, and I am addicted to running. I went back for a follow-up visit on Thursday, June 23rd, where my doctor finally said, "You can begin running again. Just do it slowly. Don't run more than 10 minutes consecutively at a time." And her last parting words to me were, "Be smart."